Well, good afternoon, everyone, and welcome. I'm Ben Bullock with Together SC, and this call is about our association health plan. And we're excited to tell you some more information about it. I'll say, just to give the history lesson here, when Together SC was founded as the South Carolina Association of Nonprofit Organizations back in 1996-97. One of the three mission points was y'all are going to create an association health plan. And the others were do an annual conference and do advocacy work on behalf of the sector. Well, we were doing two of those things fairly well. It was the third was difficult to do in the creating a health plan because the regulatory environment was very much against association health plans. And that changed in 2017, and suddenly the idea of creating an association plan for our members was much more feasible. And we worked with United Way of Greenville County, United Way Association of South Carolina, and David Slade at Marsh McLennan to get the plan set up. And we worked with Blue Cross Blue Shield to make all of that happen. And so we're 2 years in now. We're in the third year of this plan, and we're at right around 500 employees, around 34 organizations, I think. And we're really excited about the growth we have seen in this plan. And according to Blue Cross, it's the fastest growing association plan in the company right now, which is very exciting. All of this means, and David will tell you more about this, this really is a the more the merrier kind of situation. The more organizations that join, the more employees we can get into the plan where it makes sense for them. Uh, the more we can spread the overall risk, and the better the pricing can be. So what we're going to hear today is we're going to hear from David Slade. He's our broker at Marsh McLennan. He's the one who helps guide you through the proposal process and gets you set up. And then we're going to hear from Elizabeth Gibson from Coastal Conservation League, who's going to talk about her experience in getting onboarded onto the plan and making those benefits available for her employees. So without any further ado, I'll turn it over to David Slade.
Thank you, Ben, and good afternoon, everyone. Pleasure to be here. I'm David Slade with Marsh McLennan Agency. Appreciate the opportunity to update you on the Association Health Plan. Elizabeth Gibson will provide you with some additional insight after I go, just about her experiences in reviewing the program and how well it's worked for her and the Coastal Conservation League. So everyone, what we wanted to do today was to really give you an overview of the Association Health Plan. I know some of you may have heard it before, but we also want to update you, give you an idea of our plan performance, how we're doing, which things are going very well. So that's quite encouraging. Once again, how you can request a proposal and what we need. And then the benefits of association health plans, because we've had several members go through their first renewal, and it's really gone very well for them. So once again, let's do a quick overview of the health insurance landscape. Many of you are well aware of this, but it's always good to kind of update you with new numbers and new figures. We see premiums are continuing to rise at an alarming rate. There are a lot of inflationary trends going on in the healthcare arena. We have hospital systems that are now pushing for higher reimbursement from Blue Cross Blue Shield. Other carriers, we have doctors doing the same. We have drug costs escalating in excess of 10% a year. We have new specialty drugs out there that are quite costly. So unfortunately, there are many challenges in the system. Some employers are dropping coverage. Others are passing along a greater share of the cost. They're either asking employees to pay a higher percentage of premium, or they're tweaking the benefits, larger copays, deductibles, and out-of-pocket expenses. The economics are still pretty challenging. If you look at where we are in South Carolina, the average South Carolina worker earns about $19 an hour. That equates to about almost $40,000 a year. But now we look at our annual employer health premiums, pulling from some 2023 data. We see single costs in excess of $8,400 a year and family premiums running close to $2,000 a month or almost $24,000 a year. So pretty challenging environment. What that means is it's on everyone's radar, right? The status quo may not work, so we're seeing more interest in looking at options, looking at the AHP to see if we can do a better job or deliver you better benefits at a lower cost. So the value of an association health plan is really flexibility in pricing and plan designs. So we offer 18 different plan design options to anyone who wants to join. We do have composite premiums set up for you. So that means everyone pays the same premium. We're not age rating you. So it's a lot more predictable when you hire an employee or an employee wants to add a spouse or child, they know what the cost is going to be for the upcoming year. So it's a great member benefit. Being a member at Together SC and being able to access the plan has really helped the 34 groups that we have in there. We're also able to aggregate you into a large employer plan. You become a part of a major group plan at Blue Cross Blue Shield South Carolina. So they help us meet all the compliance requirements that go along with that. So whether it's COBRA or Medicare Part D notices or transparency issues, or there's a lot going on in the health benefits arena, partners who run the program take care of that on your behalf. So also it's a turnkey operation. Blue Cross Blue Shield is a health insurer on a fully insured basis. And we partner with Capstone Administrators who does all the enrollment and the billing and reconciliation. So they do a really good job and they work with Blue Cross Blue Shield on all of their association health plans. So we've gotten stellar service from Capstone as they're a key partner of ours. So we have consolidated billing on your medical, dental, and vision. If you're interested in offering additional benefits like life and disability, critical illness, accident, those coverages are also available through Mutual of Omaha, and that they can be billed through Capstone. So we've done the same thing on ancillary benefits that we've done on medical, dental, and vision. And, you know, the goal is to really educate and promote the association health plan to all members because the ultimate goal, everybody wants to do the same. You want to be able to retain your current employees and you want to have an attractive benefit plan to recruit new employees down the road. So how do AHPs lower costs is we're pulling together to lower administrative costs and improve efficiencies. So instead of having a group of 10 employees out there, we're pulling together and we have a group of 500 employees. So that lowers administrative costs. It spreads out risk in the plan and you don't have, and we can pull together and negotiate as one group versus trying to be a solo employer out there doing it on your own. We are it's a large employer plan, pulling everyone together for rating and renewal purposes. You're not subject to what goes on in the small group marketplace or individual marketplace where if you're due to the Affordable Care Act, everyone's rated the same, right? You're just taking someone based on their age and location and pricing that out, and that's all that goes into it. Where if we're benefiting from good claims experience, we can keep our rates lower and more competitive. Also, there's the higher employer allegiance when you have an association health plan because you are coming together with the common goal of controlling health benefit costs. And consistently, AHPs have been around a long time, similar to what Ben said up front. And overall, we have lower cost trends year in, year out than what small employers are able to do on their own. So quick overview as to where we are. Currently, we started on January 1st, 2022. So we're entering our third year. We currently have 34 covered nonprofits, member groups of Together SC. We're right at about 500 covered employees. So we've kind of exceeded our goals. So that's great. We continue to add groups. We're adding groups of, even larger groups. In excess of 50 employees are joining the plan. It's the fastest growing association health plan within Blue Cross Blue Shield South Carolina. What's really rewarding is about 30% of the groups that have joined are offering group health benefits for the first time, or they might have scrapped their group plan 5 years ago and done nothing, and they're coming back to offering group health insurance because we've delivered a competitive option for them. So that's really beneficial to those groups who weren't able to offer group coverage before. We also have the ability to offer ancillary benefits like flexible spending accounts or a health reimbursement arrangement or a health savings account through a qualified plan through a crew who partners with Blue Cross Blue Shield South Carolina, is integrated with Blue Cross, and is integrated with Capstone. So we can get really creative in plan designs. A small employer can now take advantage of a flex spending account, allow employees to take pre-tax dollars to pay for unreimbursed medical, dental, and vision, and use a crew to administer that on your behalf. We also have employers that are doing creative things with health reimbursement arrangements. So they may go out there and buy a $4,000 deductible and then tell their employees that they'll reimburse the difference between $2,000 and $4,000. So a crew can administer that on a Together SC member's behalf. So we have the flexibility to do things like that and get creative on plan designs. Lower the premium and have the nonprofit assume a limited amount of risk to try and get a better arrangement, a lower out-of-pocket costs for the organization and employees. And then we have all the ancillary benefits of options available through Mutual of Omaha. So that's base life and AD&D, voluntary life insurance, short-term, long-term disability, accident, and critical illness are all available for those people who opt into the medical program. Underwriting has gotten a little bit more flexible. So we do need census data, current plan summaries, and current and renewal rates. If you're in that renewal period, Blue Cross requests that. There's a general employer questionnaire. It's basically, to the best of your knowledge, aware of the following, very general questions that they ask. We've gotten more flexible on the underwriting. We used to need health statements for groups under 25 employees. Now that threshold is 10 or less. So if you are a non-Blue Cross Blue Shield group client and you have less than 10 employees, we ask everyone to complete a short health statement, and that factors into the underwriting process. If you have 11 or more employees, we can underwrite you versus a census and the employer questionnaire. 18 different medical plan design options, 2 dental plans, and 1 vision plan. You can also choose any 2 plans that you want. We target 75% participation after valid waivers. What that means is if you have people in your group who, hey, my spouse has phenomenal coverage at their employer, or they're covered through the state health plan, and I know I'm not interested in coming onto your plan, that's a valid waiver. So spouse coverage, Medicare, Medicaid, TRICARE, VA, whatever it is, those are all valid waivers. So let's say you got a group of 20 employees and you have 5 valid waivers. Blue Cross is going to want about 75% of 15 employees. So it's pretty reasonable on the participation front. And we do have different rate tiers for each organization. So when we rate you up front, we're kind of looking at your demographics and your plan information, and we have 25 different rate tiers. So on average, most of our groups fall, on average, the average rate tier might be a 13 or 14. So we have groups that can be as low as a tier 4 or 5, and some that can go in excess of 20. So we're really looking at each individual group and trying to set it up properly so it works in everyone's best interest, and it creates greater stability in the association health plan. I will say another thing, Elizabeth will talk about this. We have quoted a couple times for some groups, right? And we may not have been successful the first time we looked at a group, but the second time we might be very competitive. So I encourage some people who might have looked at it a year ago, a year and a half ago, take another look. There's nothing to lose. It's always good to know how the AHP might look against what you have right now. And a lot of times we've been successful on the second attempt. So once again, a lot of different plan design options. We have deductibles that go as low as $50 for most of our plan designs are PPO copay plans. And then we have 3 qualified high deductible health plans that are paired with health savings accounts. And then we have 2 plans that are what we call health incentive accounts. That means if the person were to do some wellness activities, that might get a credit of $375 towards a deductible. So that's one of our more popular plan design options. So a lot of options to choose from, and you have the flexibility of choosing any 2 plans you want. When you do get a proposal, you will see the rates for all 18 different plan designs, and then we'll try to benchmark it off of what you have now or just share with you what other nonprofits are doing and what are the more popular plan designs. So here are some of the more popular that we've talked about. One is a PPO copay plan that has a $30 copay for a primary care visit, 50 on the specialist, has a prescription drug card, 15 generic, 40 preferred brand, 70 non-preferred brand, and but has 50-50 co-insurance after the deductible. And what that does is it really lowers the premium. So you have a reasonable deductible. You have your office visit copays. Average employee goes to the doctor 3 to 4 times a year. Average employee takes about 10 to 12 prescriptions per person per year. You have the upfront drug card benefits, and then the deductible is $2,000, and the 50-50 coinsurance really reduces the premium. So that's a popular plan, along with the similar plan design on a $4,000 deductible, where you still have office visit copays, but they go to $50 on a primary care doctor, $100 on a specialist. Drug copays are a little bit higher. And we have a number of groups that are using this as a base plan. And then they say, this plan is very affordable to the employees. And then they say, if you want the $2,000 deductible, you pay a difference of maybe $40 or $50 a month. So that's been a good strategy. We do have a high deductible health plan that also has 50% coinsurance that's priced very competitively. That's our actually the lowest cost plan of all 18 different plan design options offered. And then we have the health incentive account, PPO copay plan that has office visit copays and drug card copays. And then we tell the employee or member, if you do 2 wellness activities that are set up through Blue Cross Blue Shield, we will credit your deductible $375. So this plan has a $3,500 plan, but if you do a couple wellness activities, it kind of buys it down to $3,000. And then some people still want to offer a lower deductible, $1,500 deductible, 80% coinsurance, office visit copays, and drug card copays. So that gives you an idea of what some of the more popular plan designs are. We have 2 different dental plan options available through Blue Cross Blue Shield South Carolina. Gives you the ability to access the dental network that Blue Cross offers throughout South Carolina, which is one of the bigger networks. So our higher option 1, has $1,000 annual max and $1,000 dependent orthodontia benefit. The single rate on the dentals, a little below $31. And then we have a leaner dental option. What this one does is it gives you a lower benefit if you go to a non-PPO dentist. There's no orthodontia. You still get $1,000 annual max, and that brings the rate down to $24. So we see most people go with option one, and most people who buy the medical end up pairing it with one of the Blue Cross dental plans. And then we have vision available through Blue Cross Blue Shield using the iMed network. So it's a $15 copay for an eye exam. You have allowances for lenses. You get a $110 allowance on frames and contacts, and pretty low rates, about $4 per employee per month. So a lot of folks offer the vision voluntary and just say, hey, if you want the vision, just pay for it with pre-tax dollars. So if you're interested in getting a proposal, I'm more than happy to assist you. I'm kind of the point person, but you can go out to the Together SC website, fill out an interest form. Ben has set that up so that all those contacts flow directly to me. I will then reach out to you to have an initial call just to kind of make sure we know what you have right now, what you're looking for, what's needed. We then send the information on to Blue Cross Blue Shield to get a proposal. Typical turnaround time is about 7 to 10 days. And then it then takes about 2 to 3 weeks before the effective date to implement the plan. So, the more time we have, the better. We have done some last minute enrollments. It just gets a little bit trickier. If you let us know on, May 28th, you want a June 1 date, it can be done, but most likely the employees won't be in the system and the employees won't have cards in hand. So the more lead time you give us, the better to implement the program. So once again, the AHP Advantage is value-added product and service for Together SC members. We're very excited about this partnership that we have, Marsh McLennan Agency with Together SC and Blue Cross Blue Shield, South Carolina. We're all community leaders throughout South Carolina. We have a long history of, supporting statewide nonprofits. This is proven to be, the people I talked to have had the plan and implemented it. It's really helped them recruit and retain talent in a very competitive job market. And it creates stability of having a large employer benefit plan at competitive rates and lower renewal increases. So appreciate your time this afternoon. And I'd like to hand things over to Elizabeth Gibson.
Thanks, David. I am working on sharing my screen. I have a little PowerPoint for everybody so you guys can see. So I just want to talk a little bit about my benefits journey and shed a little light on what we went through when we were going through this process. So to give you just an idea, our organization, on average, we have 40 eligible staff members. And as you guys know, as you are recruiting and people move on, that number goes up and down, but on average 40. Of all of those that are eligible to participate without the valid waiver, we have 82% participation, which I think is personally amazing. I think it speaks highly to our benefits. Wanted to kind of break down where that percentage is. So 64% are an employee only. We have a couple that are an employee plus spouse. We had several of us who are on family coverage, and then we have 18% that either are on their spouse's plan. We have a couple that are on Medicare, and we have a couple that are on TRICARE. So we have a wide variety. And so we have been with the AHP since 2023, so a little over a year now. I started in June of 2022, and I think I reached out to David probably in August because we were doing the age bait race, and I felt like it was incredibly expensive. And I was one of the people that was having to cover I'm so sorry, June. So I started reviewing our benefits right then and there and reached out to David about it because I felt like it was crazy expensive how much we were paying. Well, at the time, the rates were not competitive, so we did not move forward with the AHP, and so we decided we were going to stay with where we were. And Then, lo and behold, we received our renewal in March of 2023, and we were faced with an average, this is just average, 10% increase, which equaled total between what the employee paid and what the company was going to pay, $33,000. It was a huge, huge increase. And so we were being hit two ways. We were being hit for people were getting older because we were in the age-based rate tier. And then we had, the annual increase that was coming up. So it was really painful. So reached out to David and I said, okay, I need a new comparison, please. So we looked at all of our benefits and we have a wide variety, but we really focused and honed in on the medical, dental, and vision, and then our spending account. And so we ended up selecting our medical with Blue Cross Blue Shield. We selected the Plan 9. When we were reviewing all of these pieces, the Plan 9 was actually almost exactly the same that we had with small group. There was a minor difference in, I think, the max out of pocket. I think we had like a 6,000 max out of pocket, and the Plan 9, David, correct me if I'm wrong, I think is 7,350 for an individual. Does
Yeah,
that sound
correct.
right?
Yeah,
Yeah, so the cost was less, and the only difference really was the deductible. There wasn't a huge difference. And so and the cost overall just made a lot more sense to go with medical. Dental, we reviewed the dental side by side and actually elected not to go with dental or vision because our current carrier was a better bang for buck of what we were able to offer our employees, and everybody was happy. But with the flexible spending account was a really big win with so we had the flexible spending, and then we had the dependent care flexible spending account. We moved with that. And then the new benefit that we were able to add, our company offers a $10,000 life insurance policy. And David was actually able to negotiate with Mutual of Omaha, and we were able to add on accidental death and dismemberment to that piece. So not only was it now life insurance, but we were able to add AD&D, and it cost less. So we even had it was just a win all across the board. So we did end up keeping with our other carrier, our critical illness, our group accident, our supplemental life insurance, our short-term and long-term disability, and our dental and vision. But we took, but I want to talk a little bit more about how did I compare from age to tier. So the first piece that I did was we really honed in on that medical piece. So we took the average of what everybody was paying, and then we compared that to the composite rate, so the tier rate. When we looked at the final breakdown of where all of the staff were hitting, 50% actually saw a savings per paycheck for roughly the same benefit. And then the other 50% saw a nominal increase, but that increase was not any more than they would have received with the renewal and the small group. And that was hitting primarily in our employee plus spouse and our family group. So nobody was having any huge increases with the new rollover once we selected to go with that. So ultimately, we found a huge savings in our medical insurance. It was almost cost neutral to swap over. So we really didn't see an increase. We were able to offer 2 PPO plans that employees could select if they wanted to. Our other win really was in our flexible spending account. We actually realized a $480 annual savings with our flexible spending account, which is through Accrue Health. So previously, just to give you comparison, we were paying $100 a month, regardless of how many people were enrolled under our flexible spending. And when we moved over to Accrue Health, it's actually a per person charge, which ended up being less expensive even after we had an increased participation rate. And I have to say, as someone who has children and I pay for daycare right now, and I have the dependent care flexible spending account, their customer service with Accrue Health is absolutely amazing. And our team that have come to me and talked about Accrue Health, and when they've had challenges, they have all loved it as well. And then I talked a little bit about the life insurance that's an added benefit that we now get to offer. So one of the things that I realized for me was I had a huge time savings because I didn't have to calculate the age-based rate for each person once they started with our organization. From a recruiting benefit, David actually talked about this, and I can tell you that as I have recruiting conversations and I talk about the benefits that we offer, we're really competitive in the marketplace, especially with being able to do the flat tier cost rate for all of our staff. And instead of paying a 10% increase across the board, we really ended up being cost neutral. In the last year, when we went from 23 to 24, we did have an increase, but it wasn't a double whammy like it normally has been. It's just been the nominal annual increase. It ended up being, it wasn't more than $5 per paycheck for the employee. So it wasn't a crazy increase. But really, my moral of the story that I want to share is that keep trying because I've been back with David twice. And when we hit our annual renewal time in, is it November? I'll be asking about all my other benefits again because there might be another cost savings that's out there. It's been pretty exciting. We had a total with just the medical of a $33,000 savings between the company and then with the employee for the same benefit because now we get treated as a large group. And it's been absolutely phenomenal. And David and his team have been great. I've enjoyed working with Capstone anytime that I've had an issue with anything. Angela has been our person. It's been just absolutely phenomenal. And if you have any questions about how I went through my process and how I compared and reviewed, please don't hesitate to reach out to me. I am more than happy to do so.
Thank you so much. And yeah, I will ditto what you said about the team at Capstone Administrators. They just make it all very, very easy. Um, so uh, thank you, David and Elizabeth and everybody for being on the call today. I'll just echo to say, hey, if you get a proposal from us at this point and you look at it and say, hey, it's not working right now, check back with us next year. Check back with us the following year because as things go on, our plan hopefully will be more and more competitive as we go. Um, so now we can open the floor to any questions. We've got a little bit of time left. If you want to put your questions in the chat box, or if you want to raise your hand and unmute, we'd love to hear your thoughts and see how we can answer your questions. The first question I see on here, which I've answered, will we get the recording? And of course, we'll make this recording available on our YouTube channel and send that out in a follow-up email.
Hey, David. Chet Tucker here with the South Carolina Alliance of YMCAs. We have 20 YMCA associations in South Carolina, and I was curious if you would be willing to provide this type of presentation at one of our upcoming CEO calls.
Yeah, hi, Chet, and thanks for joining us. Yeah, I'd be more than happy to do that. I've done that for other associations. South Carolina Primary Healthcare Association. We've done it for some local, regional, nonprofit associations. So I'd be more than happy to do that. And we have taken a look at some of the YMCAs. So I think we can be a good fit. And we'd love the opportunity and it could be a great benefit to them. So I definitely like to get with you afterwards and get some on the calendar. It's a great idea.
Perfect. Thanks, David.
Awesome. Thank you, Chet. Any other questions? Well, as always, if we hang up on this call and suddenly you say to yourself, oh, dang it, I wish I had asked that, feel free to shoot me an email. You can shoot David an email, and Elizabeth says you can email her too. So go for it, and let us know what questions you might have, and we'll get back to you with some answers. And if there aren't any other questions, thank you so much for joining us on the call today. I hope you all have a lovely rest of your week.
Thanks, everyone.